What health is to the body, even that is honesty to the soul. Develop your spirit that may gain strength to control the body and follow the natural laws of hygiene. Good morning, respected guests, principal, vice principals, teachers, and my dear students. I am Mahalakshmi Ravindran, moderator of this webinar. I am honored and delighted to welcome you all to Aster Volunteers Back to School webinar series. Schools in Dubai are reopening with every safety precaution possible. These last few months have made us all adapt to the unforeseen circumstance that might become the new normal for us. Aster volunteers have been at the forefront of this change, working to make a difference. These efforts have touched over 2 million lives by providing support in the form of food, ration kits, medical camps, PPE distribution, etc. This impact has been powered by humanity. To keep school communities safe, Aster volunteers, along with Delhi Private School and DHA, have taken initiatives through the webinar series. In this session, experts will discuss measures to be taken to prevent the spread of COVID-19 at schools in Dubai. Without any further ado, I would like to introduce our moderators, Akriti Riki from class 11H and Sahil Singh from 11D. I would request you both to welcome our guests, Akriti and Sahil. Screen is yours. Over to you.
Good morning, everyone. My name is Akriti, and I will be moderating this Back to School webinar by the Aster Volunteers in partnership with the DHA and DPS Dubai, along with Sahil and Mahalakshmi ma'am. We are living in unprecedented times where we are faced with the obstacle of social distancing. With this in mind, I present before everyone the topic for today's webinar, which is, how is the isolation and physical distancing affecting us? And what can you do to feel better?
Before we commence this much-awaited webinar, I would like to welcome the panelists. First, we have Dr. Vivek Mundada, who is a British board-certified consultant, pediatric neurologist trained in India and the UK, and with the experience of having worked in a number of reputed hospitals in the UK. The Royal College of Pediatrics and Child Health UK has awarded him the MRC PCH and the DCH, as well as the Fellowship FRC PCH. He has been working with Aster DM Healthcare in Dubai since early 2019 as a consultant pediatric neurologist. His area of expertise involves neurological disorders in children such as complex epilepsy, childhood headaches, cerebral palsy, movement disorders, neurodevelopmental disorders, neonatal neurologies, neuromuscular disorders, complex neurodisabilities, and congenital neurological disorders. We are truly honored to host you, sir.
Next, we have Dr. Satish Kasuri, MBBS. Dr. Kasuri has graduated from the College of Medical Sciences, Chitwan, Nepal. He is registered with the Indian Medical Council and has a license with the Dubai Health Authority. Sir is a general practitioner, government medical officer, and casualty medical officer from RIIMS, Angol, Andhra Pradesh, India. He is a MD and tutor in human physiology from Narayana Medical College, Nellore, Andhra Pradesh, India. At present, Sir is working as a general practitioner at Aster DM Healthcare, Dubai, UAE. Welcome to this webinar, Sir. It's an honor to host you.
Now, we would like Dr. Vivek Mundada to start this webinar and help us through the pandemic with their much needed guidance.
Good morning, everybody. Am I audible? Yeah. So thank you for inviting me for this wonderful webinar. The topic is very interesting today because I'm going to talk on this physical distancing and isolation. How is it affecting us? So it's really how to keep the balance. So moving on, as we all know, the whole world, probably, everybody knows this virus now, or the name called Corona. And we all are waiting, when this will be over. But while we are moving on in this pandemic, We are facing many difficulties, many challenges, and really, it's what we just heard. It's a word called new normal. Is it our new normal, and how do we deal with this new normal? And I mean, this is the recent statistics from UAE, because everybody has got numbers of different questions. It's just a statistics. I've given an example, but starting from your health, your family's health, the financial problem, the jobs, the travel plans, when this will be over, the number of questions, many of them are still unanswered, and we're still perplexed. What's going on. And yeah, we're just really waiting, when will this be over? Bit of a background, because we're talking about social distancing and why this is important. So I thought I could just show you why this is important. So when we cough, so this is the diagram showing the velocity of the particles, what we exhale through the cough and sneeze. So obviously the cough, the particles will travel up to like 10 meters per second, whereas the sneeze is nearly 5 times. And because of this velocity, the distance is also more. But on an average, I think the slide is cut on the bottom, but when we say the 6 feet or nearly 2 meters is an average, what we exhale, what we cough, and what we sneeze. And that's the reason why we encourage people to stay away, at least 6 feet or 2 meters, apart from other precautions like hand hygiene and mask and etc. Another interesting thing, because I thought I'll just show you how a person infected by COVID can infect others. So statistically, a person infected by corona can infect nearly 2.5%. The most infective is measles, then is the smallpox. But again, if you see this diagram, we are in the era where we have vaccine for most of these deadly diseases like measles, mumps, and rubella or influenza. We almost have eradicated smallpox. We don't see that anymore. But again, the question of the hour is like COVID, when this will be over. So we still have this risk of spreading, quite a few. So one person nearly spreading 2.5 individual, and that is where we are. So if one person is spreading, let's say 2.5% in a 1 month, if you don't do anything, nearly more than 400 people will be infected from that one individual. Whereas if we take some precaution up to like, reduce the interaction of 50%, then the number goes down to just 15 at the end of 1 month. However, if you take more precautions and the interaction is reduced up to 75%, just look at that. The diagram is, very encouraging, and that's the whole idea of social distancing. And because of that, we probably might be able to reduce, or what we call flatten the curve of this infection. And this is why the social distancing is encouraged in this pandemic. However, the problem is, as Aristotle has said, he's a Greek philosopher, he was, and polymath in long back, before Christ, 384 to 322, and he has said a human is a social creature. That's our problem, because yes, we are asking everybody to keep distance, not to meet, not to handshake everybody, but that is really affecting us, because that's our nature, because we are social animal. With no any handshake, with no any greeting or meeting, we are becoming lonely and isolated. And that's where the problem lies, because it's kind of a double-edged sword. Yes, we need to maintain this, but on the other hand, these things are probably affecting us. When we are lonely, when we are alone, obviously there's a lot of anxiety, there's a lot of and and this stress, this anxiety can affect an individual in various other ways. And this kind of the chart shows that it can affect on your body, on our mind, on our emotions, on our behavior, and the number of different things what it can lead to. And the crux of the problem is this stress and loneliness. And yes, we need to avoid all these things while we are avoiding to get infected by corona. We don't want all these additional factors. And not only that, these issues are not very temporary, they are long-term issues. If we get anxiety, if we get all these problems, they're not just for the part of 1 month or 2 months. They can last for longer if untreated properly. And the best policy is to prevent it. In my clinical practice, when I've seen children in lockdown, I suddenly started seeing many children with headaches, and some started with tics, some came with sleep problems and anxiety, more of a depression, uh, abdominal pain without any reason, behavioral changes. seizure-like episode. And when we investigated all these children, we found out that there was no any physical reason. It was down to this lockdown, down to this isolation, actually. And I kind of conducted a study with one of the schools in Dubai with 24 children who had these symptoms. And as you can see, all these 24 children, 100% had the sleep problem. Next common was this behavioral issues. More than two-thirds of, or in a nearly two-thirds of the children had headaches and so on. So that range of different problems I had seen, and that was due to these environmental changes. When the physical examination, all these investigations were done, and suddenly the stories started coming up in the literature, in the newspaper, all this effect of mental health problems due to the isolation, the risk of weight gain, and loads of literature. It's flooded with all these new symptoms we are seeing in the individual. Now I'll stay on this slide for a few seconds, because this is where I'm going to talk about how do we deal with these negative aspects of social distancing and isolation. Because as I said, it's a double-edged sword. We are doing all these things to avoid getting infected by this deadly virus, as opposed to, when we do that, we are getting affected by even social distancing. So there are 5 ways I've just, I just picked up these things to maintain our well-being, to continue our physical as well as mental well-being. The first is to connect. Yes, we have restriction. We can't physically connect, but with whatever resources we are lucky to have been in 2020 with the technology where we can virtually connect with others. Imagine, 20 years or 30 years back, we wouldn't have been able to do this. So talk and listen and be and feel connected. So it's like feeling, if not in physically connected, it's feeling that connected. Be active in whatever way you can, even if you are indoor with whatever limited resources you have. Enjoy what you do and move your mood. Take notice. Remember, simple things that can bring joy to you. So take notice of those things and adopt those things in your daily routine. Keep learning. Yes, we are going to school, but there are other ways we can. Somebody might have lost the practice of cricket, or whatever you were doing before as a hobby. But are there other ways where you can keep learning? So these are some innovative ideas you can get. And we have to adapt to our what we call new routine. And you can surprise yourself by the way you are doing. I mean, as I said, there are tremendous ways you can do in 2020 because of the technology we have. And the last thing is give your time to others, give your words, give your presence. It's like giving positivity, being active. So that giving, sharing is caring, what we say, that brings us a lot of joy, a lot of satisfaction. If I've done something good for others, that can bring satisfaction and get rid of the negativity what you might get because of this social isolation. And just moving on these 5 principles, how do we do that? uh, as I said, connectivity. So we have the technology where you can talk on video call to your relatives in India, to your US, or anywhere in the world actually, with these new platforms. And it's really nice to see them, which you wouldn't have done if the COVID was not there, if you're not social isolating, you would have done once in a while. But now you feel that, you're really connected. I realize I've connected with my old friends who have had lost touch for many years. And that was really nice feeling. You have to be active. I know you can't go out, but you have technology, you have apps, you have YouTubes and whatnot. But whatever is ways, yoga, aerobics, whatever you can do indoor or in the limited outdoor setting, you have to be active, because that physical activity will keep you going. Whatever your hobbies are, if you have a dance, you may not be able to go to school, but I remember most of the classes are now online, and take advantage of that. It's like continuation and giving justice to your hobby. You might be interested in music, learning instrument, and it's easy these days to learn on the social platform on distance learning. You would have surprised yourself, okay, I have invented this new skill, or I've got interest in this new skill, so I have to kind of adopt this. So some of you might have taken new skills like cooking and all, or art, and this is really reinventing yourself, your skills, and adopting them in your new routine, and you'll be happy, I'm sure. One of the things we always emphasize on mental well-being is the breathing exercise. I'm sure many of your parents or school teacher would have emphasized the importance of this. And to help with this breathing exercise, I'm not going to go in detail about how to do that and all, but you have nowadays apps on your, even the wrist watch, reminding you to breathe. There are apps like Breathe Bubble or Headspace or Calm. I mean, again, the technology is helping you to adopt these new things and help you do these things. So breathing exercise is really a nice way to keep calm and, maintain that mental well-being. Going and just watching the nature is one of the beautiful things to keep your mind calm, I feel, because again, yes, you can't go, but if permitted, if you have a premises where there's not no lot of crowd, if you can step out with your mask on and just walk few steps, I'm sure you'll feel better. Because I told you, I was seeing a lot of children in clinic with all these problems, and when I asked this question, okay, what will I do, what you think is the better way, and almost everybody said, we wanted to go to school, we wanted to go to school, we wanted to see our friend. And that's how human nature is, because yes, you want to step out and see the world in reality. So it's lockdown, but as I said, keeping all that balance, of course. And sleep is one of the integral part. You might be watching all the dreadful stories, the news, but I would like to encourage you to keep away from that negativity, especially if you're watching TV before sleep. I strongly discourage to do that, please, because your bedroom is meant for sleep. Stay away from the gadget while you're in the bedroom. Talk to your parents if you have any worry. If you are anxiety, they are the best friends in your home, probably, or whoever you feel close to, your sibling. Please, please, please share your anxiety and talk to them. As I said, giving, sharing, spreading that positivity is one of the key things. So please, please do that. Stay connected with your friends. If you can't see them physically, at least you can talk to them on video call or call. Most important thing is maintaining that routine, structured routine, irrespective of you in the school, at home, the time you get up till the time you sleep, all the the meals, everything you have to, because our brain loves that routine. That's how we are designed, we are made up of. So that routine is very, very, very important. Lastly, it's important to keep that balance. On one hand, we don't want this tiny creature to come anywhere near us, but what is affecting us on the other side, yes, we need to maintain that balance of mental well-being and the physical well-being by adopting various different measures, because yes, we need to look after ourselves. And as I said, I was just emphasizing on few things how we do that. Thank you very much. Thank you.
Thank you, Dr. Mundada, for such a wonderful speech. I hope that the audience found it as invigorating as I did. Now, I would like to call Dr. Kusuri to provide us information about the adequate methods for wearing a mask.
Today we are talking about COVID-19. It's like, as usual, now we saw in many social media, any webinars, experts are talking. Now, even today, I learned some more points with my expert sitting here on pediatrics. And any time, the guidelines are simple. The common guidelines which we regularly listen is like, wearing a mask, keeping social distance for more than 2 meters, and keeping your hands always clean and maintain all food hygiene. So when you talk all about these things, don't only keep COVID-19, keep lot many diseases. You are preventing not only COVID-19, you are preventing many, many, many diseases. One second, one second. Sorry for that. And see, now if you see, like, many of the doctors now, pediatricians, general practitioners, general medicine specialists, all are telling now, many of the people are coming with same, just now our expert told, like, anxiety, stress, uh, and behavioral, emotional distress. And these things, I'll just touch a few lines. Like, recently we are talking about immunity a lot. If you see in many of the pharmacies, you see now the vitamin tablets, C, D, lot of alphabets you see there. And everyone is asking the question, is it okay to take vitamin C every day? Is it okay to take vitamin D every day? From my side, the best treatment is eat food on time. And make sure you eat a lot of vegetables, fruits, and maintain, as clearly sir told now, like, maintain good sleep. More than 6 hours at least, or 8 hours as per your age calculation. And if you can maintain good sleep, if you can do exercise for half an hour, go for a simple play, or any aerobic exercise, go for a walk, or yoga, meditation, deep breathing exercises, as sir rightly told now. If you can do, it's fine. And eating at least 5 days vegetarian diet with good vegetables and fruits and all, definitely your immunity is good. And you have to know that immunity always comes after an infection. Okay, sir, I do all these things, but my friend do all these things, but he got COVID positive. COVID positive because he didn't maintain all the precautionary steps to prevent this, like social distancing, hand hygiene, hand wash before and after food, and avoiding physical contact, and wearing a mask always when they are in open places and in a group places or outside the home. These things, if they don't maintain, they can't prevent. Immunity can't prevent COVID-19. Immunity fights against COVID-19 when we got affected with COVID. So this we have to understand. And coming to mask in schools now, once we go to a school, make sure we go with one kit, like one hand sanitizer definitely, and one box of tissues, and one box of masks. Better keep this kit in your bag always. It definitely helps you. I'll tell you, once we enter into the bus, definitely your assistant or the bus assistant will check your temperature with a non-contact thermometer. And if they found that the temperature is more than 37.5 C, then definitely they will tell to go to clinic and check. They don't allow you to the bus. And rest of the friends also don't make it as an issue there. One person got fever today, they didn't allow and all. Might be not all fevers are COVID-19. Fever with or without is the symptom now. Fever with or without, cough, cold, running nose, sore throat, throat pain, difficulty breathing, shortness of breath, it goes critical. But thing is, whoever get a fever, it doesn't mean they are COVID. Only for the safer side, we are not allowing to school. Let them go back to their home. Let their parents take to the pediatrician or general practitioner and check. And if everything is fine, symptoms has come down and they are not COVID positive, fine, they can come back to school. And the other thing is, once we enter into the school bus, we have a habit of giving high five. It's clear that don't maintain always, social distance, avoid physical contacting, and sit in your designated places where the bus driver or assistant tell you to sit. That's it. No arguments, because they are doing for your safety, for everyone's safety, for society safety also. So maintain that distance, sit, and in between the bus, if someone is not feeling well, definitely your assistant call it to your school, and they maintain isolation. They take the child to that place, and definitely they will inform to the parents or guardian, and they'll come in a private vehicle. They'll take. If it is critical, they'll call the ambulance or anything. And not like all students go to that child and go to that student and help. Avoid that. Only one person will take care with proper PPE. These things. And next, once we come, definitely from the moment we enter into the bus or the moment we come outside from home, we have to come out with mask. And till the school, till you come back home after the school, your mask should be there. You have to wear the mask. There is no exemption. Recently, we had a lot of discussions on different types of masks and different colors of masks, different shapes of masks. Mostly we suggest surgical masks now we are using, or the cloth mask, or different masks, but nothing can exempt a mask, replace a mask. Recently, I also got this information from an expert. And this mask, many of the people I see in the parks now, few areas, I see, they'll throw it in the corridors and go on the verandas or footpaths. This is a wrong practice. Once you feel that this mask is not necessary for me, there is a protocol that we have to follow. Now see, when I wear a mask, if I feel, suppose today morning I'm going to school now. Today morning I'm going to school now. First, before touching a mask, I should make sure that my hand is clean or not. How I make? For 5 minutes, the mic won't be there. Just follow me. See, look at me, then you can understand. See now, I'm going to touch my mask. I want to take out the mask. Okay. Before touching my mask, make sure my hand is clear. So how I make my hand clean? Sanitizer. If I have hand sanitizer, is fine. Or I go to my washroom and I first wet my hand and take soap and spread it evenly. And after that, make sure you interlace and rub. And again the other hand, vice versa. Then lock it and roll it so that you can clean this part of your fingers. Okay, and comes to your nails and nail beds, roll it. Now this area is left. It's clean. If it's a sanitizer, it's clean. It should take more than 20 seconds to clean your hands. Or else if you are using a soap and all, water should go away. Again, it should not come this way. So clean your hands this way, the water should leave. And after that, take a proper tissue, dry yourself, and then you can touch your mask box. This is the way you have to touch. Because my hands are clean now, I'm keeping this box also clean. Now, once I take a mask, first I have to touch the strings only. Don't ever touch the mask part. This is not the correct way. Touch the strings and take the mask. Okay, and if you clearly observe, there will be one side metal strip will be there inside, like a knob. You can see that. And these things should come up, and most of the masks, as now in WhatsApp and Facebook, they are different theories they give. White color should come out and all, mostly dark color should come out. And the outside. See this. Now, and I tell you, this is the way to take a mask. And once I have to wear it, I'll show you the different way. See. So first let me take out my mask. See, behind the ears, I took the ear strings, I took out, and I throw it in a closed dustbin. Immediately after taking out my mask, I have to again clean my hands. Because till now it gave me protection against viruses, many bacteria. There will be a lot of virus bacteria lodged on the mask, so I have to clean my hands immediately. Okay, and this thing, after that, after finishing my hand process and all, then again I will take the mask from the box. I will touch only the string part. Only the string part. I'll take it. Now I see the knob part, plastic lining, the metal lining inside. I'll take it again. I wear it, and the metal lining I have to pinch and drag. And don't touch this part again. While talking, some people will drag it down, and again they'll keep it up. It's not the way. We should not touch the mask part again. While taking the mask, we have to observe this. Any holes is there, we should not take. If it is wet, we should not. And if any, like turn mask and all, we should not use. Okay. And after that, if suppose anything, like if I sneeze or anything, if the mucus has come out, a phlegm has come out, if I cough and all, if it is visibly dirty or visibly like wet, take out the mask, as I said, take a tissue, clean and throw it in a closed dustbin. Again, clean your hands and wear a mask. Okay, for the sanitation, like hand sanitizer, for soap, the procedure will be the same. You can check in authorized websites like dha.gov.ae, WHO.in, it is World Health Organization one, cdc.gov. These are the authorized. These are authorized websites you can see, and there are many rumors are spreading around. Like they show different symptoms. They're talking about different types of testing in home only for COVID-19 and all. Don't ever believe this social media and all. There won't be any doctor's name or number. They may misguide you. Okay, and while wearing a mask, you should follow all these protocols. And once we reach home, we have to understand one thing. We have to keep up, because as per the DHA guidelines or KHT, I saw the major articles, like major tools you have which can spread the infection. Common are your pens, your books, your bags, and your shoe, which mostly changing ones. I'm sorry for the shoe, but rest of things, pens, books, your spades, your tab, your cell phone, mobile phones, and all these things don't exchange with others. Your food especially, don't share with your friends now. You have to take your own food and go, and but don't share, and keep your movement restricted. And you will have an exemption for wearing the mask only during the physical training. When you are doing any running exercises and all, that time the suffocation will be there. There you got an exemption to, you can no need to wear a mask, but you have to maintain social distancing, definitely more than 2 meters, near about 2 meters. Okay. This is very important. And once we reach home, we have to keep our shoe outside the door, better, or just once we enter to a designated place where we can sanitize, there only we have to keep our shoe. And our school bags also should be in a proper area where regularly we keep, and we have to sanitize it properly, and make sure immediately go to washroom. I show you how to take out the mask and how to keep your hands clean and all. and rest, whatever exposed parts is there, immediately wash, or else go for a shower, good shower, and keep your clothes in a closed laundry basket, and don't shake the basket, just keep it and take a good shower, come out and exchange clothes, come out, then only you can touch anyone in the family. You can stay with your family happily, because grandparents will be there. If the age is above 50 or 60, they are more vulnerable to this COVID-19, like they can't tolerate this. They don't be having a lot of immunity and all. So now it's affecting more to older people. So we have to be careful. So before entering the school, definitely maintain these personal hygiene issues and all. And once we go back home also, please maintain a personal hygiene, hand washing, social distancing, everything. Thank you so much. Thank you.
Thank you, Dr. Kasuri, for this informational and inspiring webinar. The past few months in lockdown have been tough, but with your help and guidance, all of us feel motivated and rejuvenated. Before we conclude this webinar, I now open the floor to anyone who has any question for our panelists.
Sahil Kaul from grade 11 will be asking a question now.
Firstly, sir, thank you for that very informative webinar. Dr. Vivek, extended periods of self-isolation and quarantine truly does put forward an immense amount of constraints on the emotional and psychological health of our students, especially the people born in the post-millennial generation. Many students have delved into colossal anxiety and depression during this period of quarantine. So, in your medical opinion, how long would it take for a mere student to overcome such grave problems?
I think it's a very broad question because it all depends on how much the person is affected. Again, it can be mild anxiety. The anxieties are of different forms. We're just talking about an umbrella term called anxiety. So it all depends on whether there's anxiety, there is associated depression, and what are the other aspects. It's more of a medical analysis of the issue with the help of, let's say, psychologist, or in some instances even the psychiatrist. And depending on the severity, it really, I mean, in the mild anxiety, you might just do the environmental modification, as I said, all these different environmental changes, and things will be fine. But let's say in my last 6 months experience, I have referred at least 3 children to psychiatrists. So it's kind of peak of that pyramid, where I had seen very difficult to manage children, and I needed help of psychologists in many of the cases, almost like 40 to 50% of the children who I came across. And rest, I think we're just monitoring while the school is now reopened. Hopefully things will settle down, when the environmental changes are there in the modified circumstances. So it depends on the severity and the assessment, honestly speaking.
Thank you, sir, for that answer. Now we have Pragyat Sood from grade 11 to ask another question.
So, considering the fact that we took about 5 months to get used to this new normal of isolation, do you think that adjustment back to normal will come effortlessly?
Can you repeat the question? Sorry, it was not audible.
Considering the fact that we took about 5 months to get used to this new normal of isolation, do you think that the adjustment back to normal will come effortlessly?
Well, there are many unanswered questions, to be honest. We don't know. It all depends on how things are moving. We are learning while the pandemic is moving forward. Yes, there's this new normal, but really, do we call this as a normal? Adopted this to call it as a normal daily routine. To go back, I know there are many factors. Many are asking, when the vaccine will come, how much it will be effective. But honestly speaking, we don't know the answers. We can be only optimistic and hopeful, I think. And hopefully, when I can't answer that, but I can be only optimistic and hopeful that yes, we will be back to where we were the pre-COVID era.
All right, then. Now Prajakta Pitre from grade 11 will be asking another question.
Good morning, sir. My question is directed towards Mrs. Satish. Sir, prolonged periods of isolation have affected our physical health adversely. Could you suggest some measures to combat the same?
Physical health. So you are talking about your physical health, like how to maintain and all, right?
Yes, sir.
Yeah. Coming to physical health, I'll tell you, rightly, as per now, like, if you see the COVID-19 situation and all, or the regular your lifestyle things and all, make sure if you want to maintain a physical health properly, do some aerobic exercises in the morning, maintain a good sleep, as I told you now, like more than 6 hours. And coming to food and all, if you are like nutrition, nutrition definitely plays a major role here. And keep your foods like your plate should be of 65% carbs and 15 proteins and rest 20 with fats. And go for any dairy products like curd, cheese, butter, such things which keeps your like digestional tract with a good bacteria necessary for the digestion. And eat some nuts, definitely it helps you, like with amino acids essentially you get it if you don't have any nut for like dry nut allergy and all. And seafoods, definitely you get zinc. And these are all like we need like a lot of vitamins and minerals. So if you go for 1 cup of vegetable salad or fruit salad with your lunch and all, definitely the vitamins and minerals will be good. Don't go for refrigerated foods at this moment, like go always for the fresh which is good for you. And other thing is like many people now they are telling like if you go for a ginger or garlic, this is good. It doesn't mean that we take lots of ginger and garlic, like a piece of garlic or ginger definitely will help you. And protein diet we always suggest, definitely make sure you eat some protein, like meat, like non-vegetarian is rich in protein like fish, chicken. And this thing even red meat, no, it's rich in protein, but we don't encourage every day. Like weekly at least twice you have to go for a non-vegetarian diet. All your immunity are nothing but proteins. If you take a proper this thing, and all your enzymes, your reactions, whatever chemical reactions happen under proteins, definitely proteins help in it. And this thing, if you can maintain all these things, definitely you will be physically fit. And if any chronic illnesses are there, definitely the treatment have to be taken. Take advice from your doctor and continue the treatment along with a good diet and good sleep and exercise, definitely. And stress will come down if you do deep breathing exercise, if you sleep properly and all. And fine, you can maintain a good health in this way.
All right, sir. Thank you. Now we have Prakriti Dandona from grade 11 with a question.
Good morning, sir. Firstly, thank you so much for your very informative tips. So, my question to you is that the current pandemic has definitely brought many mental changes, especially extreme anxiety and depression amongst the youngsters. So, are there any measures that you can suggest to overcome this feeling and have some social interactions, keeping in mind the physical distancing rules?
I think I've already answered that question in my presentation, the various ways you can probably try to avoid. So again, going back, yes, you need to maintain, because as I was emphasizing, we are social creature. So we need that social contact. How you do, I mean, as I was saying, and I was summarizing, the principles are the same, maintaining your mental well-being and the physical well-being. The ways have gone different. We can't see, or we can't meet somebody, we can't hug somebody, or we can't handshake somebody. There are a lot of limitations. But in this new normal, the ways you could do it virtually, meeting others, staying connected is one of the things, so as much as possible. So, and in whatever ways you can, by the phone calls or Zoom meetings, or video calls, whatever ways you can. Now you are able to go to school. Some of you, I don't know if you have this opportunity, but yes, at least you can see your friends, talk to them physically. So that's the way you can stay connected. I was emphasizing on reinventing your skills, creating the new hobbies. Please give justice to your hobbies. You might not have had time to give them, but in the lockdown, or when you have ample of time, please utilize it in positively. You might have missed a book to read. You might have, missed to learn a guitar, but now you have ample of time. You don't have to go physically to any class, and you can do it at the leisure, at your home. So that's something you can do. My daughter is learning Kathak, and my learning, but everybody's at home and doing it online, giving justice, creating these new skills, and of course spreading that positivity. If you have something good to give to others, please do share with them. If somebody is needing help, please do that. Your neighbors, your friends, talk to them and lift their morale. I think that's the best way we can do in the circumstances we are in at the moment.
Thank you, sir. And now with the last question for this webinar, we have Rishad Antia from grade 11.
Right. Good morning to both of you. My question is that after the World Health Organization released a statement that everyone has to wear masks, there are still some people who don't wear them. Now, for the people that do, could you please tell us the difference what a homemade mask between a homemade mask and a professional K95 mask?
Oh, okay, see. Like after the World Health, actually previously the World Health Organization, they told like, no need to wear everyone, like only few who are not feeling well and all. But later on they changed. And they changed, they clearly mentioned that we have to follow our local health authority guidelines. Whatever WHO says, we don't, no need to follow. But our local health authority have some guidelines which we have to definitely follow, like our Dubai Health Authority. Like they are telling like there are exemption to some people who no need to wear a mask. Suppose if I am not mentally, if I am mentally ill, okay, fine, I have exempted. And below 6 years, or who have a chronic respiratory illness, no need to wear a mask. And coming to homemade masks and all, we always suggest this mask, like surgical mask is fine. The medical mask which can be disposed of, like disposable one, after 4 or 5 hours, we can take out, throw it out, and wear a new mask. Throw it out in sense in a proper protocol, and wear a new one, it's fine. And coming to your, as you are telling, homemade mask is the cloth mask you are telling. We are preparing a cloth mask or purchasing a cloth mask which we can reuse. Once we take such mask, we should know how to reuse it also, or else it also will lead to a lot of infections again. We are lodging a forceful infection inside, and we are locking to your nose and forcefully taking inside. But what we do, once we take any cloth masks and all, just once we use it, after that keep it in a closed cover, take to your home. Once you go back to your home, keep this for like your mask for at least 7 to 10 hours in hot water, soak it in hot water. Later on you wash it properly with a proper detergent, dry it up, and no need to wear immediately the next day. Make sure keep of 7 or 8 masks with you, and alternate day or every third day keep it as a cycle and use this, and this will be fine. And there are a lot of masks, N99, N95, but at this moment we always like the best one is your surgical mask, which is most helpful to you. And if not, then definitely the cloth mask, but you should know how to properly use it, or else it leads to a lot of infection.
Thank you, sir. I hope that all of the queries are answered by both our panelists and Aster DM Healthcare, which is always working to fulfill its promise of "we'll treat you well." I would now like to conclude this webinar with the popular saying by the United Nations Secretary General, Sir Antonio Guterres: "We are in this together, and we will get through this together." Once again, thank you, Dr. Mundada and Dr. Kusuri, for this beautiful webinar. Over to Mahamam.
Thank you, Akriti and Sahil. I hope that you all find this session informative and worthwhile. Our experts did an amazing job of sharing their expertise with you. Your responsibility and positivity spirit make the session more meaningful and protective. Thank you all for attending the session. Thank you.